Hello, my name is Suzanne Zimnick, and I am the Chief Officer for Educational Research and Strategic Partner Development at the American Society for Clinical Pathology. On behalf of ASCP, we welcome you to today's webinar to help you learn more about the RFP issued recently by ASCP and Pfizer for quality improvement projects in molecular testing pathways for metastatic colorectal cancer. The need identified by ASCP and Pfizer for this multi-year initiative is to address persistent gaps in molecular testing, communication, and care coordination that impact frontline treatment decisions for patients with mCRC. Today's presenters are Dr. Sachin Gupta, who is the Scientific Director at ASCP, Osiris Rojas, our Senior Manager of Grant Operations at ASCP, and Amanda Stein, the Senior Director for Cluster Lead Grants at Pfizer Inc. Amanda is on the call today to assist us in answering your questions. So here's the agenda for today's webinar. We're going to provide you just a very quick overview of ASCP if you're not familiar with our organization, more information on the program goal and objectives for this RFP. We're going to dive a little deeper into the Performance and Diagnostics Insights, or PDI platform, which is the basis for the grant-funded projects. We'll be providing an overview of the grant opportunity, including key dates and grantee expectations. And finally, we'll end with a question and answer session. So just a few reminders for today's webinar. Please type your questions at any time throughout the presentation in the Q&A box. Closed captioning is provided, and the recording of today's webinar will be available at the ASCP site within 2 weeks post-event. The American Society for Clinical Pathology is the oldest at 102 years and the world's largest professional membership organization for pathologists and laboratory professionals with more than 100,000 members. The mission of ASCP is to provide excellence in education, certification, and advocacy on behalf of patients in the entire laboratory workforce. With nearly 1,000 educational activities, ASCP is the worldwide leader in providing education and CME/CMLE credit for the entire laboratory team. ASCP has extensive experience supporting practice-based performance improvement initiatives such as this one, as well as biomarker testing education and quality benchmarking. This grant opportunity is from ASCP in collaboration with Pfizer Inc. and with participation from our partner, the American Society of Clinical Oncology. And with that, I will turn it over to Dr. Gupta.
Thank you so much, Suzanne, for introduction and giving the background about the ASCP and about this grant opportunity. Welcome, everybody. My name is Sachin Gupta. I'm the Scientific Director at ASCP. And I will be reviewing today the details of this grant opportunity, RFP, about the goals and objectives of this grant, about the eligibility criteria, and going over, as Suzanne mentioned, a little bit about our PDI platform. So first of all, the problem statement, why we are doing this project, why Pfizer and ASCP has come up with this grant opportunity. Since we have noticed that we have variations in the ordering practices of various biomarkers testing for patients with metastatic colorectal cancer. And along with, there are delays in these results of this biomarker testing that undermines diagnostic excellence and that contributes to suboptimal frontline treatment decisions for patients with mCRC. So with that problem in mind, we actually came up with a program goal. And as Suzanne mentioned, this is a multi-year pathology-centric quality improvement initiative. And the goal of this initiative is to address persistent gaps in the biomarker testing, various biomarker testing, the molecular testing, the communication of those biomarker results, and the care coordination among various teams that impact the frontline treatment decisions for patients with mCRC. So through this program, we aim to achieve the following objectives. So through this program, we will evaluate, we will describe, we'll study the current biomarker testing processes and identify the variations in the test ordering protocols. Since we know that there are variations in the ordering practices of this biomarker testing, there are so many biomarkers. So hopefully we will evaluate those biomarkers as per the NCCN guidelines, and we will evaluate. Along with that, we will evaluate the turnaround times on the ordering, collection, receiving in the lab, and then reporting of these results, reporting workflows, and operational efficiencies. We will also address the communication gaps to ensure the timely communication and dissemination of those results to the care teams. Through this program, we also hoping to strengthen the care coordination among various teams. For example, pathologist and oncologist, so that the oncologist can make informed diagnostics and therapeutic decisions for the treatment of these patients. And then we will also identify variations among various institutions, like how these biomarker testings is being received and how these results are being integrated into the patient's EMR, EHR. So we will identify those practices and improve. And then last but not the least, we will establish pathways for accelerated molecular diagnostics to support optimal frontline treatment. That is the ultimate goal of this project. So since we mentioned that this is a QI, quality improvement initiative, so we want that the various institutions or the grantees, they utilize the QI methodology for these projects. For example, they can use various QI tools, the QI framework, like Plan, Do, Study Act or Plan, Do, Check Act cycles to review the progress and improve. The multidisciplinary team concept, again, you will hear this again and again, that we really want this project to be a multidisciplinary project where we really want all the care teams to be involved in this project, right? So that is an important aspect of this project, where we really want the project team should include all essential care team members, including pathologists and oncologists and any navigation care team members who are actually involved in the care of these mCRC patients, so that we can the oncologist can take the informed decisions about the treatment on these patients. Conducted root cause analysis. We really want the institutions to conduct the RCAs to really understand, to identify the root cause of the issues, like why there are variations in the ordering practices, for instance, why there are delays in the communication of the results, why there are variations in integrating those results into the EMR, why there are delays in the treatment, initiating the treatment, the frontline treatment of these patients. So we really want the sites to utilize the RCA's analysis for identifying these issues. Then implement the targeted intervention. We want these practical solutions such as the streamlining ordering processes, solutions, and enhanced result communication processes for these various interventions. And then, of course, the track key metrics and measures, like which align with recognized QI measures, for example, ordering protocols, testing rates, turnaround times, and treatment alignment. So let me talk about the project budget. So as you know, the Pfizer will be funding this project, this grant, and there is a total of $1.5 million, a total funding, and multiple grants will be awarded through this opportunity. And each grant will be from $150,000 to $250,000. So the applicants should request a grant amount. It varies from $150,000 to $250,000 based upon their proposed budget. And each funded grant site will be required to pay a flat fee of $50,000 to the ASCP to support participation in the PDI, which I will explain in a minute, into our Performance and Diagnostics Insights platform for data analysis and benchmarking evaluation. So this $50,000 fee should be included in the total grant request amount and incorporated into the proposed budget. Allowable costs, direct costs and indirect costs. Again, these are standard institutional overhead fee capped at 28% of the requested grant amount per Pfizer policy. My colleague Osiris can speak to it in a few minutes if anybody has any more questions. If you plan to include any new positions for staffing into your proposal, those you need to include a sustainability plan for those roles beyond the grant period for those new positions. Eligibility criteria. So the proposals are invited from various patient care organizations actively engaged in the mCRC management. So what it means that eligible organizations must be affiliated with a laboratory capable of performing those biomarker testing, or those institutions, they must have an established processes to refer that testing to one or more qualified reference laboratories. And some of the examples of these organizations which may qualify include healthcare organizations, healthcare systems and networks, community hospitals, and cancer centers. So any organization basically who's involved in the patient care of these patients and affiliated with the laboratory for this molecular testing. So only the organizations, not individuals, are eligible to apply. As I mentioned, we really want this project to be a multidisciplinary project. So we really want the applicant organization must designate two PIs, two principal investigators, to lead this project. So one principal investigator must be a pathologist and other as an oncologist. The roles might be interchangeable, where an oncologist might be a PI or a pathologist can be a co-PI. The PI serves as a primary point of contact for the applicant's organization. Pathologist PI or co-PI must be an active ASCP member at the time of the award. I just want to clarify, they need not to be an active ASCP member at the time of application, but at the time of the award, they have to be an active ASCP member. Both PI and co-PIs must be part of that multidisciplinary team, the project team. The PI must be an employee or the contractor of the requesting organizations. Intra and inter-institutional collaborations are encouraged, again, in that QI framework, providing all partners have a defined role and the requesting organization plays a central leadership role in that project. Now, let me a little bit talk about our Performance and Diagnostics Insights, which is a required component of this project. So the ASCP Analytics and Benchmarking Platform, which is a Performance and Diagnostics Insights, it's a cutting-edge analytics and benchmarking platform. So what we do in this, we actually receive the real-time data from the institutions, and then we ingest the data, we transform the data into actionable insights to measure various performance measures and benchmark various measures against the peers. PDI or Performance and Diagnostics Insights has dedicated dashboards for anatomic pathology, and that also includes diagnostic and biomarker testing reports. So participation in the ASCP's PDI is a required component of this grant program. So the funded organizations will be expected to sign a PDI participation agreement and a BAA, which is a business associate agreement with ASCP once the grant is awarded. The institution or the sites will agree to share their real-time data, LIS data or the EHR data with ASCP through secured interface between ASCP and the institutions. And we will utilize the PDI tools and resources to support planning, to analyze the data, to analyze the baseline data, benchmarking, evaluation, and the quality improvement. So these are the required sections for the proposal. So the list includes, so you need to include, and more details, by the way, are in the application, in the RFP, but here are the list, like project goals and objectives. You need to, of course, describe your goals of your QI project. What are the needs and assessment of the project? So perceived gaps across the various pre-analytical, analytical, and post-analytical phases of the care. Target audience, highlight the patient volumes, demographic diversity, and any unique characteristics relevant to the mCRC care. Project design and methods, detailed plan of achieving your objectives, outline strategies for achieving various outcomes, evaluations, ensuring sustainability, and disseminating your findings. A timeline of your QI project, then details of your institution, about your multidisciplinary team and the QI expertise, QI experience, and how you will utilize the QI to really drive this project. Additional information, again, the budget. You need to provide a detailed budget and a signed letter of institutional approval for participation into the PDI for data analysis and evaluation. As a part of this program, ASCP and Pfizer has convened an expert review panel. We call it ERP. The ERP will review and approve the grant applications. The ERP will review quarterly grantee reports. So they will be the one who will be reviewing the progress of the project. They will also join quarterly calls with the grantees. And in addition to that, the ERP members will also serve as a mentors, and they will provide mentorship to the grantees throughout the program to help guide their work and support success in this program. So with that, I will hand over this presentation to Osiris and Osiris Rojas to discuss, how to submit the application and some key timelines and dates. Osiris, over to you.
Thank you so much, Sachin. And so now a note on how to submit your applications. So all applications must be submitted through Pfizer's grant management system, and you can find a direct link to Pfizer's grant system in section 10, which is in page 7 of the RFP. And applicants must complete all the required sections, which Sachin just pointed to earlier, and must upload the full proposal to be considered. Grantee requirements. As Sachin mentioned, we do have a couple of grantee requirements or expectations for this funding opportunity. As has been alluded to by Sachin, we are going to have grantees submit quarterly updates and interim and final reports to Pfizer. And also, grantees are going to be participating in a grant kickoff meeting in June 2026. And that's going to be a really great opportunity for grantees to all meet each other and to start and kick off this process. Also, grantees are going to participate in a grantee and ERP meeting in November 2026, which was going to be at the ASCP annual meeting in Montreal, Canada, and there will be travel support for that. Also, grantees, and as part of this project overall, we're hoping will disseminate findings within your institution and also to other relevant stakeholders, as well as the broader community. Think as examples, disseminating your findings in conferences and in publications. And again, to reiterate what Dr. Gupta said, we're hoping that all grantees participate in the ASCP PDI. And a requirement of this is that we do have to include a signed letter of institutional approval from all applicants. The letter can be included in the optional appendix of the application, and we do have a letter template that we've linked to in the RFP on page 6. Just a note that the head of IT must be the one that signs this to confirm authorization to participate in the PDI platform and to share data. As we've mentioned previously, the pathologist PI and co-PI must also be an active member of ASCP at the time of award. Again, you don't have to be an active member of ASCP at the time of application, but at the time of award. And lastly, grant agreements must be executed with Pfizer. For this funding opportunity, the proposals will be peer reviewed by an expert review panel that ASCP and Pfizer has convened. The ERP will evaluate the submissions based on a variety of criteria, such as clear and well-defined goals and metrics that directly support the objectives we've outlined in the RFP. Dr. Gupta also went over those objectives earlier. Also, relevance to patient care and unmet needs, potential impact on biomarker-driven diagnosis and treatment, your organizational capability, infrastructure, and collaboration across multidisciplinary teams, the strength, feasibility, and innovation of the project design and the implementation plan, and that there's defined measurable outcomes and strategies for sustaining improvements. And while this is not a requirement, QI experience of the applicant team is preferred but not required. So here we have some key dates for this funding opportunity. The full proposal is due March 31st at 11:59 p.m. EST. The review period is going to be April and May 2026, with the anticipated notification date of May 2026. And the project duration is about 1.5 years from June 2026, when we'll have that grantee kickoff, to December 2027. And lastly, if you're in the Pfizer Cyber Grants portal and you're having any difficulties or you have any questions about the portal itself, use the technical questions link in Cyber Grants. If you have questions about the program or the RFP, email grant@ascp.org and we'll make sure your question is answered promptly. Thank you so much, and I'll pass it back over to Sachin.
Thank you so much, Osiris. It's time for Q&A. If you have any questions, please type your questions in a Q&A box. We'll be happy to address.
We do have some questions, Dr. Gupta, that we think that some of you may be thinking. Oh, here we go. We finally have a question. Can we please get a copy of the presentation? Yes, 100%. We're going to be sharing this. You'll get an email with a link within 2 weeks to this recording. And also it's going to be on the ASCP website. I'll put in the chat here what the website is. Some other questions that we think might come up is, can you explain further how PDI will be used in this project, Sachin?
Yes, absolutely. Yeah, this is one of the questions which we are receiving through via emails, which is a very good question. People are wondering like how they will be sharing the data, how the data will be utilized, what is the value of the PDI. As I mentioned in the presentation, the PDI is our analytics and benchmarking platform. So the goal is to have all the data being received into the ASCP so that we can analyze all the data and do a benchmarking analysis so that we can work on this QI project. So how the data will be received, again, we have a secure protocol for transferring the data. There are 2 ways the data can be transferred. Number one, either we can have a data being transferred through a VPN interface where we can have the HL7 messages from the site, from the institution, being transferred over to ASCP. So the HL7 message will have all the information about your, it's basically an LIS feed where we have the ordering information and the patient information, we have the diagnostic information, we have all the biomarker testing results. And then what we do after we receive that file or that message, we transform it and we parse out all the relevant fields, all the relevant data out of that HL7. So that is one way of receiving or getting the data through the VPN. The second process is through the SFTP, where safe file transfer protocol, where if you have, let's say, some institutions, especially the sites which have Epic, they're able to get the data into a CSV format, right? All the diagnostic data, all the diagnosis, all the biomarker testing results into the CSV format. We can also have that file being uploaded into a safe folder at ASCP. So it can be a daily transfer file upload through the SFTP protocol. So that is another way. And all these terms, we will describe that through the BAA, which will sign with the site, with the grantee. But as we mentioned, participation into the PDI is a required component into this proposal, and we really want your IT head to sign that letter. There's a link in the RFP for that letter you can download and have that signed and attached with your application. Osiris, are there any other questions?
Yes, we have another one that has come through. Can you outline which biomarkers we will need to include in the project initiative?
Very good question. So although we did mention a couple of biomarkers in the RFP like BRAF, RAS, HER2, MSI testing and all that, it does not need to be only those biomarkers. It has to be all as per the NCCN guidelines, all the for the metastatic colorectal cancer. So it doesn't need to be only those biomarkers. So make sure you include all the biomarkers what you're using in your practices and how we can standardize, how we can improve the testing and the communication of those results.
Thank you so much, Dr. Gupta. Another question that we received is, does the RFP support pathology-led system-wide harmonization of mCRC molecular testing across academic and community sites?
Yes, yeah. Since this is a pathology-centric project, we really want it to be a multidisciplinary project. So it will. We hope to improve that communication throughout your academic institution. I hope I answered that question. And Suzanne, if you can chime in if I did not answer that question very clearly.
No, that's sufficient. Thank you.
Thank you.
Another question we have here is, do we need to submit our application to ASCP and Pfizer? No, you only submit your application directly to Pfizer through the Cyber Grants portal. Another question we received is, does the principal investigator must be an active member of ASCP? Does this requirement need to be met at the time of application submission or at the time of the award? It is at the time of the award that the co-PI or PI pathologist must be an active member of ASCP. Dr. Gupta, did you have any other questions that you wanted to make sure we addressed?
I cannot think of any other questions, but feel free to, as in this presentation or in the RFP, there is a email. Please feel free to reach out to that email and ask any questions.
We received one more question. Do both path PI and co-PI have to be ASCP members?
No, so the co-PI has to be oncologist. So the oncologist doesn't need to be an ASCP member. Only the PI, like pathology, PI or a co-PI. So pathologist can be PI or co-PI in this project. Only a pathologist, PI or co-PI has to be an ASCP member at the time of the award, not at the time of the proposal application.
I don't see any other questions that have come up, but if there are other questions, like we shared earlier, you can email grants@ascp.org, and we will make sure to get back to you promptly.
Yes, thank you. Thank you, Cyrus. And thank you, everybody, all the speakers, Suzanne, Amanda, Cyrus, for being on the call. So thank you all, so much, all of you attending this webinar. So this is the link of the RFP where you can scan and get to the RFP application link. And as Suzanne mentioned at the starting of this presentation, the on-demand recording of this presentation will be available on our ASCP website, and the information of all the details about that to access that information will be emailed to you, and you will be able to hear this recording. And again, there's an email, grants, I believe, at ascp.org. You can reach out to that. You can ask any questions at that email. Send your questions to that email, and we'll be happy to answer any further questions you have. Again, thank you very much for attending this informational webinar. We appreciate all of you, and we hope to receive your applications. And hopefully, we'll have a great project, QI project, and improve care of these mCRC patients. Thank you very much.